Well, many of you continue to reach out with questions about the coronavirus and the latest booster shot. So Dr. Mallika Marshall joins us again with answers. And we begin with Lisa, who writes, I am quite nervous about getting the new vaccine. I am boosted once with the original booster, but because this one is so new and not tested in clinical trials, I am worried about potential side effects down the road.
Well, I don't think you should be worried because the technology that was used to create this new booster is really the same technology that was used to create the original COVID-19 vaccines and boosters. So for that reason, it really didn't need to go through stringent clinical trials like the original ones did before it was rolled out. So there's really no reason for you to be any more concerned about this bivalent booster than you were about previous shot. You should get the new updated booster to protect you from severe illness this winter, and don't forget to get your flu shot.
Flu shot as well. All right, doctor. And Carolyn says, I am very afraid of long COVID. What's the prevalence we're seeing in people who are fully boosted and having their first COVID infection?
So we're waiting for some more data on this, but it does seem to appear that people who have been vaccinated and boosted are less likely to develop long COVID after a breakthrough infection compared to people who have not been vaccinated at all against COVID-19. Now, of course, the best way to protect yourself is to stay up to date on those vaccines and those boosters. Take good care of your health, get good sleep, eat a healthy diet, and try to avoid getting COVID the best you can.
Do all the healthy things.
Exactly.
Kelly asks, how long can you test positive after COVID on an at-home test?
So this is a slightly complicated question, but look, most people, assuming that they're not immunocompromised, will no longer test positive on one of those rapid home antigen tests after 10 days. But some people will. Some people will go 11, 12, 13 days. But look, if you're feeling better and you've isolated for a full 10 days, you're unlikely to still be contagious. That said, if you're still testing positive and you're going to be around someone who might be at risk for severe COVID, I would continue to mask around them. So be careful around your elderly grandmother, for example.
And the holidays are right around the corner.
That's right.
So, Debbie says, I've been hearing a lot about RSV lately and wondered how contagious is it and whether it's mostly a kid virus.
Yes and yes. It's RSV is also known as the respiratory syncytial virus, and it's a respiratory virus that we typically see in colder months. But as you know, we're seeing a rash of cases right now in our community. It is quite contagious. It's passed from person to person, like most respiratory viruses, through contaminated respiratory droplets and having direct contact with someone who is already sick. It doesn't typically cause more than just the common cold in adults and in older children, but in little babies or people who are immunocompromised or have underlying health problems, it can cause more severe respiratory illness with wheezing and difficulty breathing. So if your child has any of that, please get them seen right away.
Those little bronchioles.
I know.
When a child comes into the ER, does a nebulizer, kind of asthma kind of medication help?
You know, it's interesting. If it's the first time a child has bronchiolitis, sometimes they don't work. If they're having subsequent infections, then sometimes it can. But I usually give them a trial of albuterol in the clinic to see if it helps.
Just to see if it helps.
I just had one on Tuesday.
Oh, good.
He's doing better.
And he's better, see, because of you. Dr.
course.
Mallika Marshall, thank you so much.
You're welcome.
Dr. Mallika offers her best advice. But as always, consult your personal doctor before making any decisions about your health. And if you have a question for Dr. Mallika about coronavirus or any other medical issue, here are the 3 ways to reach her. Email drmallika@cbs.com, Twitter @Mallika Marshall, or Facebook message her, Dr. Mallika Marshall.